At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Foot Function and Skeletal Health on Wednesday, January 22nd at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live. It's been quite a week, right? It's been lots of snow and it's cold and it's going to stay like this for a while. Cold anyway. We're not going to get any more snow, at least for about another 9-10 days. But listen, what amazes me is the hysteria that propagates all things. It's like, oh my God, a snowstorm just slammed into the East Coast. Really slammed? Well, maybe 6-8 inches of slamming. I'm not sure which, but nevertheless, I grew up in the western part of New York State, and average snowfall was something in the neighborhood of 250 inches a year, and that was a lot of snow. We went to school. I can't remember having school closed, and kids went about and they fell in the snowdrifts and they did whatever they're going to do, and they never really got excited about it. But what's really funny, and I think I mentioned it last week, that you watch people going into the grocery stores and they're buying up milk by the gallons. They're getting toilet paper. It's the weirdest thing that I've ever seen. Why? Do you think this is going to last until, the end days of Armageddon? I don't know, but, just come on, chill, everybody. It's kind of crazy. We're going to get into a little bit of a hysterical thing in our bit in the news today, but then we're going to talk about your feet again and want to remind you that on the 22nd of January, this good old 2025 at the Roselle Center for Healing in Fairfax, Dr. Harlan Browning, the professor, and I are going to be doing an evening on how your feet will affect all portions of your skeletal spine, causing pain, dysfunction, imbalance, dizziness, all kinds of things. Your feet. Yeah, your feet. So join us. All you have to do is go to RoselleCare, RoselleCare.com, RoselleCare.com, and register. It's right online. Roll it down. You'll see it. Click the button and register. Or the old-fashioned way, 703-698-7117. And you can register that way. The only thing that we ask you, because these are a gift to you as a community, is that if you can't make it and you've registered for the class, call us up, day before and say, hey, listen, I can't make it, so we can prepare and let other people in. As many of you know that our classes are usually full. Let's get into the program. And I want to give you a little bit of news and, kind of go through this hysteria. How many of you have had the drugstores reach out to you and say, hey, we're giving out flu shots, come and get yours. And they are going kind of whack-a-mole as far as I'm concerned. And they're talking particularly now on two things. But one is this bird flu. And it's like, oh my God, the bird flu is out and about and, we're all going to die from it, right? Well, let me give you some actual data on this situation. The first reported death was just recently in Louisiana. They say it's over 65-year-old guy, but it was reported by the Louisiana Department of Health. How old was he? They didn't tell you, because that's a positioning piece, right? Over 65. Why? Because they want to get all of you that are over 65 to go get your shot. The infection came about after an exposure to wild birds in the backyard. It's like, really? Okay. So what they go on to say is this, right? The World Health Organization logged 939 human cases globally around the world since 2003. 939 cases since 2003, of which 464 were fatal, although most cases and deaths occurred prior to 2015. Now, that's interesting, right? Last year, there were 3 deaths that were linked to the bird flu worldwide. Now, my friends, when you think about the number of people that die just from, having a cold that goes into a respiratory system, they're far more that way. This is not a public emergency, even though the state of California declared a public health emergency to better manage the bird flu outbreaks. Are you kidding me? Really? Do your homework. Be skeptical of what you're hearing. We've had these types of things around, and as I told you repetitively, take your vitamin D, get your vitamin C up, take your zinc up, get a good probiotic in your body, and I promise you, you knock out the sugar and increase your immunological reaction, get a little exercise, and you'll find that you're going to beat the majority of anything that's out there. But this bird flu nonsense, as of January the 6th, 2025, there's been 66 confirmed human cases of this so-called H5N1 bird flu in the United States since 2024, and 67 since 2022. Do the math, my friends. That's 2 years and only 6. Really? And that we finally had one person that died of it. And, and it's always sad to have anybody pass away or die from anything like this. But this is how you have to take the time to interpret what's being said and what's being promulgated out there. Because at the end of the day, you got a better risk of getting your butt handed to you walking across the street because some fool, isn't watching where they're going as they're driving the car. Enough said. Let's get into talking about your feet. Listen, we want to remind you that in 2025, that if any of you have an organization, you have a club, you have a church, you have a group, it can be anything from veterans group to social group, mother's club or grandparents club. And if you'd like one of our doctors to come and lecture as a gift to you, we do that through the 501c3 Caring for Others Foundation that we support. And we are, involved in presenting information. All you got to do is call the Roselle Center for Healing or send us a note at 703-698-7117 or go online at rosellecare.com and send the note to Sybil, Sybil, Sybil McFarland, and ask her, say, hey, listen, I want to talk to you about having somebody come out and do a conversation. We'll talk and present some data. And we'll do whatever you want to do. It's a lot of fun. We enjoy these and we enjoy giving back. Let's talk about your feet, my friends. We're going to talk about walking today and the things that you need to do to keep your health and the benefits. Did you know, if you listen to the program, you do, that if you walk 2 miles every day. I'm not telling you how fast you have to do it, but you accumulate 2 miles every day, that you have a 50% less risk of dying of a disease process than anybody else does. That's a true number. 50% less of a risk of dying of a disease process if you walk 2 miles every day. Just go out for a walk, get up in the morning, stretch, get a glass of water, and get your tushkas outside and go for a walk. I mean, there's a tremendous amount of benefits, and we're going to get into in the live stream. And don't forget to follow me as soon as we're off WMAL. Go to drtomroselle.com and click the button and follow us. Those of you who follow us on all the social media sites, you'll be aware when we're there, but get it done anyway. So walking barefooted is extraordinarily good for your health. Taking time each day to walk around, even in your house, barefooted. And, when you're outside, even better, right? Get your feet in the grass. Yeah, wash your feet afterwards. You're not going to die of, ptomaine Joe or anything like that. I promise you that it's good for you. Walk barefooted. It can improve your physical and your mental health. You walk without shoes strengthens the muscles of your feet because it has to deal with balance. So if you're having a little problem with, balance, this is a great thing for you to start adding to your daily practice. A practice called grounding, is letting your bare feet touch the ground outside. It can decrease stress, improve your health, clear up your headspace, make you feel better, put a different light on the subject, so to speak. I promise you, it's amazing. I walk in the house, the first thing that comes off are my shoes, and then I take my socks off. And that's how I walk around the rest of the day. You ever come to visit me, I'm going to answer the door probably barefooted. So don't be surprised if that takes place. But anyway, when children are first learning to walk, parents are encouraged to allow them to walk barefooted. Barefoot walking has a tremendous effect on children's small feet, and it stimulates what we call neuroreceptors from your feet all the way up. It stimulates the brainstem, your old rudimentary portion of your brain that allows you to move and walk and function and so forth. For all of us adults, those crazy people that have grown up a little bit, walking barefoot may help restore natural walking pattern. But here's the thing: if you're wearing heavily cushioned shoes, it can alter the way your foot lands on the ground, so you have no natural propulsion. When you join us on the 22nd, I promise you, we're going to get into showing you why that is. We're going to show you exactly how it handles, the integrity of your spinal system, muscle firing, and so forth. But people who walk barefooted, had to put more pressure on the middle of their foot and the toe area and on their heels and so forth. And they were more aware of what's going on. So going off and getting all kinds of, if you will, inserts and foot supports, albeit we use them in a limited way because, there's a lot of people selling inserts out there, right? And they're expensive. And we only do them when absolutely positive. But the point of it is that you want to avoid having to have anything like that. And walking barefoot is one of the best things you can do for the muscles of your feet and your legs and so forth. And you'd be surprised what really takes place. So it improves the mechanics, and you're going to learn that on the 22nd as well. You're going to improve the mechanics of your body and how the body hits, and you're going to avoid things like called bunions, that hammer toe that gets out there. It's kind of lateral to the inside of your foot, and it hurts like crazy, and it could be a result of gout as well. But that problem can be avoided and made better if you do that. We're going to talk about how it's going to affect your posture. I'm going to save that to the 22nd. We're not going to get into that heavily today, but I want you to know that your posture pattern can be very determinant based on how your feet are working, and all that pain, that recurrent irritation, that spinal locking, that fixation, the loss of range of motion, that comes in many, many cases from your feet. So if you'd like to add to the ability to get rid of the pain, be able to stand up straight, have better sensitivity about your entire environment, your feet, my friends, your feet, we've got to deal with it. So when we get into let's go back to, I want to go back to that grounding piece, that walking on outside barefooted. I get out in the morning, and if everybody saw me, they think I'm crazy. I open the front door, and we still have our Christmas lights out. So I go out and I unplug them and, make that happen. But I go out, I don't have anything on my feet. And, it's cold out there. I'll stand there for a while, and I'll look around, and I'll breathe in, and I'll kind of stretch a little bit. And my neighbors think that I'm half crazy, but that goes along with the Sicilian territory. But anyway, no, seriously, and I do that. And I walk through the house, I go in the garage and barefooted, and you'll be surprised what happens. There's huge amount of data, studies that are out there that people who walk barefooted regularly, and particularly children that walk barefooted regularly, have a significantly improved cognition and decreased stress. So their stress load, their depression, their anxiety drops measurably, and their ability to remember and to be aware significantly increases. And that goes for all of us, not just kids. And the studies are there. Go in and start looking it up and do the data. Remember I said, read your stuff, and you'll find that, life can be a whole lot better just by walking around barefooted. So here's what you need to do. When you start walking, that 2 miles, you can do it. You could even do it barefoot. Walk around your house when the weather's good, outside. And when you're inside, walk around barefooted. That'll help, but keep walking. But walk barefoot. Start slowly. The muscles of your feet and legs may not be used to walking like that, and particularly for an extended period of time. You're not, crazy boy like me. But you have to walk short periods of time. And then guess what? You may have to rub and caress your feet and your calf muscles and so forth, because you've been wearing these crazy shoes that give you no movement whatsoever. And say, oh, my feet are, I need a cast in there. No, you don't. You need to have flexibility in your feet, and you have to be able to move gently. So if you go out, take a pair of shoes with you, throw them over your shoulder. And then, if you're out walking around and all of a sudden your feet says, I think I've had enough, then you can stop and kind of rub your feet and put your shoes and socks on and do it that way. The best way is if you can get to a beach and you can walk on the sand. That's the best way of walking barefooted, because now you have this irregular ground underneath you, and it stimulates what we call the mechanoreceptors, the nerve receptor sites on your feet, causing your whole body, to be better. Depending on the surface, that you're on. If you've always had your feet covered, and it's like, wearing shoulder pads, I guess, on your feet, you may start developing a little bit of thickening of the skin, patches on your skin, calluses, if you want to call them that way, but it'll get better. You have to rub and do it. What are the risks of it? Well, you can scrape it up a little bit. Yeah, so what? Could you get fungus in your feet by walking barefoot in certain areas? Yeah, if you're walking in somebody's public bathroom, the risk of that type of situation, we used to call it athlete's feet. We had to be careful with that. So we got to keep your feet dry, and you sometimes put just a little bit of old-fashioned talcum powder on it, and you'll be surprised. It's a pretty good deal. Now, if you're diabetic and you have foot ulcers, you need to be a little bit more aware of it. If you have true plantar fasciitis, irritation, inflammatory reaction at the bottom of your foot, walking barefoot will aggravate it until we get rid of that. And that's what we're going to talk about, by the way, as well. On the 22nd, we're going to cover that. We're going to cover, that whole situation, what you can do about it and why it affects you and what the bottom line is. But there's nobody better at this than Dr. Harlan Browning. Trust me, he's in the office. He's the go-to guy when it comes to feet and ankles and knees and so forth. He's got his act together, and you're going to notice that. Those of you know that I'm just telling you something that's redundant, and you really have it together. So, that old foot of ours, we really have to be aware that we got to take care of it. And here's the deal. Here's something that I'd like you all to do. I'm going to give you some really straight up stuff. We're going to talk about it more in the live stream in a few minutes. Get a golf ball. Go to one of the golf shops and buy yourself some of those shag balls. They're not new. You don't have to spend a fortune on them. And put one in your pocket, put it in the office at your desk, keep a couple around the house. And when you're sitting around, just take that golf ball, make sure you take your shoes off, and you put it on the ground, and then roll your foot back and forth, side to side, one side to the other, up and down. And you're going to find some spots that are a little sore because the muscle isn't balanced in your foot. And that'll help roll out the fascia, and it'll help it begin to have its normal alignment and presentation. It'll stimulate the strength that should be there. Some of them are just the covering, the fascia that is like saran wrap, if you will, or plastic wrap, is tight, and that will begin to loosen it. Get your fingers down there and begin to rub your feet and strip out your calves, just like you're digging in like a piece of dough. Just work it. You'll be surprised just doing that, how much benefit you'll derive from proper, attention. And then if you go to drtomroselle.com and you go to the Ageless Health store, there's a couple items there that I would encourage you to look at. One is called Medi Natura Traumeel, Traumeel ointment, and that gets rid of the irritation and the soreness and so forth. There's another one right next to it. It's called Dead Sea Salt Bath Salt. So here, what you do with that is this. You take a half a cup of Dead Sea Salt, and you get a basin of water, and you put it in there, and you soak your feet. And you'll be surprised the Dead Sea Salt from the Dead Sea will relax, will heal, will decrease the inflammatory reaction. So you've got two things there that can make your feet a whole lot better, and that's the Traumeel ointment, and that's the Dead Sea Salt that you can put in your hot water and get your feet to relax a little bit, right? And then if you have an inflammatory reaction, you go down and there's something called biofreeze. So we try to put things in that we use all the time that can make a huge difference in how your body reacts. But here you go. So, I'm telling you, go outside and walk, right? and say, well, what happens if my feet hurt? Well, there you got some things that will drop it down and make you feel a whole lot better. And, we're telling you, go slowly. Don't do it all at one time. When the weather is good, you're going to get outside and you're going to walk on the grass barefooted. I don't care what your dogs look like. You think, well, I got all these crustaceans in there. And then you're going to go inside, you're going to wash your feet off, and you're going to dry them. You can put a little powder on them. And that way your feet stay healthy. You can do this. There's a lot more you can do. I'm just giving you a little bit of things that maybe you hadn't thought about. And if you had, you hadn't tried. So we want to make sure that you have that opportunity to really change things around. It's important. It's truly important that you begin to understand that the base platform, your feet, the foundational principles of your spine, is one of the most important things that you have to take care of. And if you're covering them up all the time with shoes, if the shoes have no flexibility, you're not doing things to help and strengthen your feet. And there's a lot more we're going to tell you on the 22nd, things that you can do to make a difference. I promise you, it's going to be a great night. You're going to learn a whole lot of stuff, and it's going to make a difference. So here's the deal. Make sure you're paying attention. Take care of your dogs, your feet. Walk 2 miles every day. Walk barefooted as soon as you get in the house. Rub your feet. Put ointment on them. Keep them dry. And don't do the same old damage that you would do to your system over and over and over again. You can do this. You really can. I promise you. Walking is a good thing for you. And when you do that, right, when you walk and all of a sudden your head's clearer, and all of a sudden, you have a little bit more energy, and you're not as stiff, and you don't hurt quite as much as you used to hurt, guess what? Life is going to get a whole lot better. We're coming right up to the end of the program. You need to join me on live stream in about 1 or 2 minutes. Go to drtomroselle.com, and we'll be there, and we're going to continue the process. Remember, I'm here every Sunday for you, bringing you a little bit different piece of the information. Make sure you do your homework. Don't get scared with all the hype on the radio, the television, so forth. And know that I'm here for you for one reason only. I love you all. I'll see you next week. Have a great Sunday and enjoy that sunshine. Go for a walk. Do it now. Bye. I'll see you in a few minutes.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums.
Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Foot Function and Skeletal Health on Wednesday, January 22nd at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
you.